Thank you all for being here. We appreciate you stopping by. We're going to take your calls for the next hour or so on Twitter Spaces. It's somewhat new technology for us, so we're sort of trying it out today for the first time. It looks like we're on our way. So if you're on the Twitter Spaces room, it's much like a clubhouse room. You just request to come up, and I'll bring you up to the front of the room, and you have a chance to ask your questions. And by requesting, you are consenting to be streamed out on YouTube, Twitch, Twitter, Rumble, many other places, Facebook, wherever we're out. There it is. There's a example of what it looks like on Twitter Spaces. So we're going to try that out today. A lot going on in the world. I've got some thoughts on monkeypox that's driving me a little bit insane. I also got some ideas about shutdowns and the current economic problem, but I mostly want to hear your questions. So we'll get right to it after this.
Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
As we said, today is sort of a special episode. We are just sort of taking your calls, and we're taking them off Twitter Spaces for the first time using that particular platform. Susan, are you good today on this Monday?
Yeah, I'm good. I'm trying to get all the platforms up and tell Jeremy Murphy how to do this.
Okay, good.
I mean, first day is always, a little nerve-wracking.
I see my friend Andrew Ashkazvili
Hi,
out
everybody
there
on Twitter.
On the restream. Andrew, any thoughts about what's going on in the world today? My basic sort of preoccupation lately, I noticed somebody retweeted a video by a young man who had monkeypox. And he was talking about how he contracted it in this video, and a physician retweeted it and says, "It's important we know this." There are somewhere between 45 and 50 cases of monkeypox amongst 350 million people here in the United States. I just went ahead and I went over and checked out some other incidences of other illnesses, just so I had it here. Echinococcus is 350 cases a year. Tularemia is also about 5 per 1 million, so it's about somewhere around 450 cases a year. Murine typhus, it's not even required for reporting, so it's very common, endemic in Southern California. And tuberculosis, there are about 7,000 cases reported in the last year. Much more dangerous illnesses, much more common. Why aren't we talking about tularemia and tuberculosis? Why the preoccupation with monkeypox?
Don't get yourself in trouble, Dr. Drew.
You think we're going to get axed out of Twitter Spaces?
No, but wonder if it's like it's worse, and then they go,
well,
you said
fair
it was
enough.
Just like the flu.
Okay, well, fair enough. If it becomes, it looks as though it's very odd because it looks like the household transmission rate is higher than COVID, but outside of the household, it doesn't transmit. It does not appear to be a respiratory virus. So it's very unlikely that it's going to be a significant, let's say when we're done, there are 5,000 cases. When it runs its course, let's say there are 5,000. Not fun, not good, nor is it good there are 7,000 cases of tuberculosis. What should we do about that? Should we freak out about tuberculosis? Should we freak out about murine typhus? Should we freak out about brucellosis? Should we freak out about leptospirosis? Things you've never heard of because the press isn't reporting it, because they're making an issue of this one thing because they think it makes a good story. That's what I'm sort of getting disgusted by. Now, I will happily I don't want to be wrong. I mean, I could be wrong that the monkeypox turns out to be a much more significant problem than it appears to be. But my point being, there are very serious infectious disease out there that appear to be much more common, Now, they've made they at one point, as you heard me talk about on Thursday, made an issue about the CDC on their website said we should be wearing a mask to prevent a non-respiratory virus. And I saw that and I went a little bit crazy about it because that was bizarre. And it really suggests what I've been worried about, that either they're just strictly trying to manipulate behavior or they're incompetent. And I don't mind people, sort of making a case for masks. I have no problem with that. I think there's a good case for an individual wearing an N95 mask to protect him or herself only, not to protect other people, to protect him or herself. And if we're in the middle of an outbreak, I want people to protect themselves. That's a decent argument. But to claim that it'd be important to wear a mask for monkeypox, well, it'd be much more important for tuberculosis. Tuberculosis, I think it's around 40%, 40% of people with tuberculosis are aerosolizers and become highly contagious with tuberculosis. So we shouldn't we be educating people about that? I'm just saying. So anyway, that was one of the things that had me concerned today. The other thing, the Russ Savage says, let's worry about the rats and the plague. The plague is coming across the country. The plague is a little less frequent. Let's see incidents of plague. Let's see how many cases of plague there are in the United States. Incidents of plague, U.S. About 20 cases per year, something like that. So it's less than monkeypox by about half as many as monkeypox. Not a 100th, about half. Now, to be fair, monkeypox is in its early days. It might spread a bit more, and it has spread a bit more in Africa. But the way it is being reported is what troubles me. It's not contextualized, and I'm trying to contextualize it. By the same token, I look back at the last 2 years, and I think about our lack of contextualization of COVID and our run to lockdown to copy the zero COVID policy of the Chinese Communist Party, which has been shown to be deeply flawed, has now caused some really very serious economic ripples. And we're all going through that right now, and it is not going to be fun. I saw an article this morning that was tying the current economic sort of earthquakes specifically with the lockdown. There was a British MPs were talking about this. And I thought, how could it not be? I mean, you make tiny adjustments in a money supply or a rate hike, and you get massive changes in the economy. Of course, it creates massive changes when the whole world shuts down, money supply is massively increased. Now, I'm not saying it's all bad. Maybe we can inflate our way out of debt. I mean, that's an interesting problem. It didn't work in Germany after the First World War, but I'm certainly there are other examples in history of where people have done this, and it probably has maybe been a net benefit. I don't know. Maybe somebody can help me with that historically. I'm looking at the Restream. So I'm watching you guys on Restream quickly. I'm going to go over to Rumble, see what people are thinking there. Okay, you guys are worried about the panic aspect, which I was worried about too. But let's be fair. The whole world went into panic, right? It wasn't just us. The whole world, save Florida, Sweden, a couple other places where they seem to have been a little more measured in their approach. All right, there we go. So that's my concerns today. I want to take your calls.
I'm looking for Jeremy on the Twitter. He said he's on there, but it's hard to find. We have a lot of people out there.
Yes, we appreciate you guys
in
stopping
Twitter space.
by.
You have to raise your hand.
Well, it's called.
I guess.
No, it's called BA. Caleb, help us with this. I see listeners and I see.
So how do they?
I believe so. Down at the bottom, I think it's on the bottom left corner on most phones. Then you click on request.
There's a mic.
Yeah, and it's like raising your hand.
You click on there, and then you're probably going to be muted, so you're going to have to unmute yourself as
once
well.
I call you up.
But I don't see Jeremy. He said he was listening, but I don't know if he's.
Maybe,
oh, there he is. There he is.
Okay.
He doesn't have a face because he's not very Twitter savvy.
Okay.
But he's on there. I see him. He's down at the bottom.
All right. Well, he can raise his hand.
But he's got to rate. You got to
request. I'm going to
go.
This is going to be our first.
Because he wants to talk about Justin Bieber.
Okay. So, maybe we should do that first then.
I know. I'm trying to get him to.
Where is he?
He's way at the bottom. He just says Jeremy, and he doesn't have. He's right next to Lana. Do you see? They don't. A lot of these people don't use Twitter a lot, so this was a first day of.
Okay, so
but at least he got on there. I'm very proud of him.
I invited him to speak, so there you go. I think that's him.
Okay.
And Jeremy, let's see if you can get up here to the. Whoops.
See if you can do it, Jeremy.
I think I just. Oh, here we go.
Hung up on him. Eliminated him.
I don't know what I'm doing here. This is a little bit of a different technology than we were used to.
This is cool though. There's a lot of people out there.
Okay, all right.
But raise your hand and Drew will click on your avatar and bring you up.
Okay, give me a second here just to kind of scroll through some of the stuff.
Jeremy needs a picture.
Well, let me talk about Justin Bieber a little bit, because that was another thing that kind of went a little haywire, a little bit sideways. And let me try to get Jeremy again. Invite to speak. Let's see if he can respond to that. Jeremy, I invited you to speak. Let's see if that's a possibility. So Justin Bieber has Ramsay Hunt syndrome, right? There are a lot of famous syndromes of facial pain of various types. There's something called Toulouse-Hunt syndrome. There's Ramsay Hunt syndrome. And Ramsay Hunt syndrome is just essentially Bell's palsy caused by a specific viral agent. It's the Bell's palsy associated with pain. That's how we kind of know it's the varicella-zoster virus that's causing the Bell's palsy. And it can often have a little vesicular eruption in the ear, which is sort of what's called a herpetiform eruption, which is typical of shingles. So Ramsay Hunt, I'm not even sure he had Ramsay Hunt. He certainly had Bell's palsy. And to call it Ramsay Hunt doesn't really matter because it's treated the same anyway. It's treated with antiviral medication and corticosteroids. I did see some literature that suggested, one of the standard therapies for Bell's palsy is prednisone and acyclovir. And I saw some data that suggested that methylprednisolone is better for Ramsay Hunt. So there is one reason that diagnosis should be parsed out from the rest. So let me invite others. Whoops. Do I invite them to co-host, Caleb, or do I invite them to speak?
No, invite them to speak.
There we go.
Yeah.
Okay. Wyatt.
Yeah, Jeremy's having a hard time.
Okay, Wyatt, there you are.
He'll get there.
Hi, Wyatt.
Hey, how's it going?
Ooh,
Thanks for having me up.
Sounds good. What's going on?
Huge fan,
Thank
Dr.
you.
Drew. What's
Thank you,
going on? I'm working. I'm a DoorDasher, so I'm just driving around right now. But I thought I'd hop in here because I have some questions for you.
All right, let's do it.
All right. So I'm 23 years old. I don't have health insurance, and I think that I need an Adderall subscription, but I don't, or prescription, and I don't really. How would I approach a doctor and seek that out?
Well, right now you live in somewhat of a golden age of what's called telehealth or telemedicine. And you can go online and find low-cost evaluations. Now, the psychiatric piece is harder to come by, but you might be able to find a general doctor that would be willing to do this. So I would just look up telehealth in your area, see if you can find somebody that's reasonably priced. And I think literally for $100, I mean, less than the price of the prescription, you can definitely get an evaluation and probably have somebody prescribe that for you.
Okay. Is there anything maybe like that I should go into that? Like, look like something that like I would say that a doctor or somebody reading that telehealth thing would be like, okay, this guy needs this.
Well, I mean, you just answer their questions. I mean, you don't want to distort what, you don't want to mislead the clinician. You just want to go, look, I can't concentrate. I have trouble, ordering things. I don't get things done. I procrastinate them. And have you ever been on it in the past?
No, I haven't been prescribed it in the past. I've like tried it before, right. And it felt great, felt focused.
Have you, I'm not a fan of Adderall for adults, I have to be honest with you. Do you have any history with addiction yourself?
No.
Okay. All right. So it's people that have history of addiction that I really worry about it. For other people, right. I prefer, well, you talk to the doctor, in this particular case, but I hate to see you on a psychostimulant, how does this work? Okay, there we go. I hate to see a psychostimulant used chronically just because you have a little trouble concentrating. But if you need it for certain circumstances, that kind of makes sense to me. I'm going to try to keep going through some of the calls here. Whoops.
So I'm trying to, okay, so Jeremy only sees hearts. So you see there's two little heads next to the hearts, and then there's a plus sign. So he's in the wrong screen. I can't figure out how to get over I don't know. Poor Jeremy.
Just look, I've got After Dark. Who is After Dark?
That's probably Heather.
Hello. I'm just a Twitter Space account. We do a lot of different Twitter Spaces. But I wanted to say, Dr. Drew, I am glad that you are in Twitter Spaces. There are hundreds of spaces that, do your type of format and, the love line format. And I would love to see you do more of these. This is awesome.
Well, we were using Clubhouse. It's just a great way to interact as I see it. And so my sort of little model is that we're on enough platforms that we're essentially broadcasting. And that the call-in is all these great technologies we have, whether it's Clubhouse or Twitter Spaces. And so you can be there and interact with me. So we will be doing a lot of this. Caleb, what do you think? Do you think most of the time we're going to be on Twitter Spaces?
I mean, there's a significant number of people here on Twitter Spaces, so we might be using this a lot more often now.
Okay, so that's a yes. So he's a
Yes.
tentative yes. So that'll be Tuesday, Wednesday, Thursday at 3 p.m. Pacific time. We'll send out blasts and whatnot. Sometimes we adjust the time a little bit. I have lots of interesting guests on too that you can sort of ask questions of as well. They're zoomed in here. Coming up, I have, let me tell you who I've got coming up. You see, I just agreed to a bunch of guests and they're not showing up on the calendar just yet. Gleb Sibursky is coming in. He's a cognitive psychologist. Susan, have you seen this week's schedule?
No, I haven't. I'm still trying to get, Jeremy's not going to make it.
Okay, well, poor Jeremy.
Maybe you will. I don't know.
But be that as it may, we have lots of cool stuff, lots of good guests, and lots of interaction. And let me ask you this. What is, After Dark, what's your actual name?
My name's Chaz.
Chaz.
C-H-A-Z. Yeah.
Chaz, can we bring up more than one person and do interactions and that kind of thing up here?
Yeah,
Okay.
yeah. So there's a few different things you can do. You can you can manually invite people. People can request to come up. You can also have co-hosts. So it looks like Caleb's helping you out. You can make him a co-host, and he can actually help you, moderate the conversation, bring people up, so you're not fumbling around with it.
Right.
It's really cool, and people can also share tweets in the space.
Yeah, that's good. Everybody share a tweet right now.
How do you do that?
Well,
where do I see that?
So the people that are speaking, they're able to share something on top. So
yeah, so
I'll grab.
See there's a little arrow that points up. You click on that and it shares. I shared it to my Twitter already.
I have a little pencil in the right hand corner. That's not it.
So that composes a tweet. But if you actually go to someone else's tweet, you can hit the share button and you can actually put it on top of this space. So right now I went to your page. I shared your tweet to the top of the page. Now the whole audience can see that tweet.
Got it.
Oh,
outstanding.
See, that's really good.
Well,
I used to do that with Periscope.
Thank you for joining me.
It was
Chaz,
great on
appreciate it.
Periscope, but then Periscope stopped letting people have comments. So
okay, well, I have lots of callers.
It's a good way to really
go
show
through.
you're
So
out
let's
there, I
let's
guess.
go do it. We'll try to get to as many people as possible.
Jeremy said he's only getting the video, which is weird because it's just audio on there. So he must be looking at the video for the restream.
That's weird. Coco, are you there?
Yes. Hi, how you doing today, Dr. Joe?
Good. How are you?
I'm good. It's really good to see you on Spaces. I've actually been doing Spaces since day one, since they started. So if you need any help or tips or tricks, I can help you with that.
Thank you.
But also I had a question. So I'm a big mental health advocate, but I also have lupus and I'm a big lupus advocate. I have been struggling with it for, I'd say, about 15 years. I went undiagnosed for a really long time. And I have 3 forms of lupus. So the systematic, the discoid, and I can never say the other one, the erythemus. I can never say it right. But I have
discoid,
been
systemic, and erythematosus.
Yes, thank you. It's a tongue twister.
Yeah.
But one of the biggest frustrations I've had is I feel like I'm only dealing with that, but also 2 herniated discs. And so I'm struggling to find ways to get pain relief. I use turmeric, I use curcumin, I use a lot of different stuff. I've even done, cryotherapy, acupuncture, and I just can't seem to find the pain relief that I need, and just wanted to know if you have any suggestions for that.
As you know, the opiates can, lead to more pain. That's the real problem. But sometimes mild opiates like tramadol are helpful. Have you tried that?
The issue is, I have such a high tolerance. I was born with spina bifida, and so I had 3 surgeries by the time I was like 16, and they basically had me like on a morphine drip.
Oh boy.
And so I think since then I've just had such a high tolerance. Tramadol. And then I also have to be careful because I have to stay away from anything that hurts my kidneys.
Have you right, because of the lupus. Have you tried, this is going to sound bizarre, but have you tried any kind of hypnotic therapies, or trauma therapies? These sort of, I'm going to talk to a hypnomagneticist. I don't know what hell he's doing, but I'm interested in that whole space. And, breathing, hypnosis, this is going to sound goofy, but I really believe that sometimes when you help regulate your autonomic nervous system, your ability to perceive and tolerate pain is significantly altered. Have you had specific trauma therapies?
You know what? I actually, the only trauma therapy that I've had would be EMDR therapy.
You had it.
And
Good.
I did find that actually very beneficial. And I did both forms of it. But, and I even read the book, The Body Keeps Score. With,
yep.
Yeah, great book.
Mm-hmm.
And so I do know that, trauma and things like that can be tied in with, autoimmune disorders and pain. And I haven't tried any hypnotherapy, but I would be interested in learning more about it.
And then breathing. That's another thing, breathing techniques and things. These are all, when you have pain like this, you have to bring in everything you can possibly get your hands on. There's The Body Keeps the Score by Dr. Vanderkolk. It is nothing should be off the table. You know what I mean? And usually it's a multiplicity of different things that gets you to somewhere where you have some sort of pain relief. But I wish I had something magic to tell you. I do not. Right now I'm looking into a book called Breathe, B-R-E-A-T-H, that somebody touted as excellent for various kinds of regulatory. I see it all as sort of regulating pain, regulating emotions, regulating what the feelings coming out of our body. And it gets goofy. It gets a little goofy. It gets a little outside of the sort of mainstream medical kinds of recommendations. But there's a lot there. There's a lot of people doing this kind of things. I'm glad you did EMDR. That is very courageous of you. I'm glad you did acupuncture. There are other, as you know, other sort of bodily-based therapeutics. You can't do anything too aggressive because you have all these structural problems. But I would keep looking. I'm sorry I don't have anything sort of dramatic to offer. This is just Alex. Alex, your mic is muted. I can see that. So down the lower left, there you are. What's up?
Sorry about that.
Mm-hmm.
So I heard hypnotherapy in there.
Mm-hmm.
I figured I'd ask.
Okay.
Heard of quantum healing hypnotherapy?
I've heard of, I know nothing about this space. I'm just recently starting to read about it. But there are a lot of people that claim a lot of things, and
Yeah.
I don't know what to make of it yet, except that when people are in need of, when they're desperately in need of something, I'm always willing to kind of entertain these things that to me makes sense. It makes sense that if in an interpersonal space, if you can get any kind of a deep trusting state going, you can improve your regulation. That's sort of the way I can conceive of it. And I hearken back to Good Science by Stephen Porges and Alan Shore. And so the interpersonal neurobiology is kind of worked out. We just haven't worked out the clinical applications in all settings yet. So that's what, But I'm going to bring somebody in here soon to talk about it. And I claim ignorance. And I hear things. I hear things, I read things, and I claim ignorance. But I wouldn't normally bring it up unless there was, sort of desperation. Why, do you have some experience with this?
I've just been looking into it for the last couple of years.
Yeah.
Started really getting back into it in the last couple of weeks.
Yeah.
And I figured now is the perfect time to.
Well, report back. Let us know what the experience is like, and please, I think anecdotes are not. Anecdotes don't put me in a position to make recommendations, but I think anecdotes have meaning, and people should sort of listen to them. Hold on a second here. Lots of you are requested. I'm trying to get through you guys.
I know. I see Jeremy in there, but he can't figure it out.
That's really funny.
He goes, I'm like 100-year-old man.
Limp Bisquick Pancakes. Are you
Yes.
there? There you are. What's up?
Yes, I am.
Hey.
Don't you like the name? Limp Bizkit.
I get it.
Pancake.
I get it.
Yeah. Anyways, I'm 38. 39 now, but at 38, I had a heart attack.
Oh my gosh.
And I'm on a ton of meds. Yeah, I know. The American diet, salt, red meat, whatever. And it wasn't like I wasn't athletic. I played basketball through college. But 2 weeks prior to that, I was also diagnosed as epileptic. So heavy benzos with that. But the list of medications for the heart attack are like baby aspirin, Astravan, Claudia, whatever, can't pronounce it, formicicide.
Okay, so I'll slow you down. So did you hang on? Was it a completed heart attack where you damaged the muscle, or do you now have a stent in and you preserve the muscle?
6 stents.
6 stents.
6.
Wowie.
Yeah.
Do you have familial hypercholesterolemia? Familial?
Yes, I do actually.
Okay, because that's
Which
what
I didn't find out until after my heart attack.
right. That's how you get a heart attack. You either smoking or FH is how you get a 30-year-old heart attack. So okay, well that sucks. But once you have a stent, you buy essentially 5 medications. So you have aspirin, you have the platelet inhibitors. You're going to get a statin. You're going to get some sort of beta blocker or calcium channel blocker, and you're probably going to get some sort of ARB. So boom, right off the top,
well,
that's what you're getting.
Yep. Plus Coumadin, because I have a clot in the heart as well. So
oh my goodness, dude.
Yeah, I know. Woo. You wouldn't expect it from me, but anyways, my question is, I'm fairly young and my wife is going into that period of her life where she wants to be more intimate, and obviously there's some problems, right? So we haven't broached the subject of when I can start taking the purple or the blue pill.
Yeah.
But
who's we?
So I was wondering,
who's we haven't broached it?
What's the name of the place? It's the Heart Failure Clinic. Horrible name, if you ask me.
Okay. Do you have congestive heart failure also?
No, I don't.
Okay, good. So you're talking about your clinic. Are you on nitrates? Are you on Imdur or anything like that, or Kdur or any of these?
No.
I mean, I'm sorry, or the transdermal nitrates, because the nitrates are really what give the problem to the PDE5s inhibitors, right? That's the class that Viagra is in. And that class has 4 or 5 different medications in it, and some of them aren't commonly prescribed, but some of them are a little easier to tolerate than the others. You really need to work with your cardiologist on this, but I don't think you're obviously at special risk, but I don't think it's contraindicated based on what you're telling me. So you should be able to do that, and there should be no problem.
So my question is, where can I pee on my wife and not get her pregnant?
Where can you pee on your wife? Is that a After Dark thing, or is that an Adam thing, or am I supposed to be able to follow that?
Get her pregnant. I don't want more kids.
Well, it looks like you're not going to be having sex until you get the blue pill, so it might work out.
So maybe they can also, I'm just thinking maybe they can do a vasectomy as part of the deal, or maybe she can get her tubes tied, or obviously she can be on
birth control,
sort of hormonal birth control. There's a lot of options. The bigger problem is with your cardiac condition is getting you back to the point where you can function. And I would make a real issue of that because it's important. And if your doctors are ignoring that, that's not okay.
That's because he has heart problems. That's why he has ED.
I think it's when you have coronary disease, you all typically So he has something called familial hypercholesterolemia, which is a really high cholesterol. It's associated with advanced vascular pathology. So the fact that he has it going on in his heart means that he also has it going on in the artery to his penis. So it's not just the heart disease, it's not just the heart medication, it's also the artery going to the penis. So he really needs help getting blood, getting the nitric oxide pathways to respond to what blood input there is. And so he's going to need these kinds of medication in order to do that. There also are, a lot of people, we're going to get Ashley Winter in here as a urologist, and we're going to talk about the implants and how happy the men are when they get these implants. It's better than you think. So that's another option, is to go with the devices that are available. But anyway, I think PDE5 inhibitors, they're called, would be certainly a reasonable way to go, provided your cardiologist agrees with that. But it would be very important to deal with it. So it's not like just correcting the cardio. So when men present in their 40s and 50s and 60s with erectile dysfunction, the first order of business is getting on a treadmill and ruling out heart disease, because the erectile dysfunction can be the first sign of heart disease just from the cardiac part. But because he has FH, I can predict the penile artery is about 7 times more sensitive to the hardening of the arteries from the coronary arteries. He's going to have stuff in the penile artery as well, which makes it that much more important that he be on high dose statins, that he take these medications or maybe do an implant to help him, and that he pay attention to this stuff. Some of it can be reversed, but it requires high doses of these medications to reverse it, we think. And those medicines can cause further erectile dysfunction on top of it. So he's fighting an interesting battle that he should be carefully working out with his doctors. So I'll tell you what, we are still here.
Did you see the comments on Rumble?
No, let me look over there.
There's one that was talking about Justin and his wife. He goes, what are the chances? With the jab, pretty high it seems. So someone might consider that.
So the vaccine has been associated with Bell's palsy, right? So it's possible. I've not seen it specifically associated with Ramsay Hunt, but I'm not 100% sure he had Ramsay Hunt. It may have just been run-of-the-mill Bell's palsy, which would have been more likely the case that it was from or related to the vaccine. Her syndrome, I promise you, is, well, let's reason about it. I'll tell you about her syndrome. It's completely
after the break.
Completely unrelated to what he had, which is a viral recrudescence of the nerve in the facial nerve. It sort of causes the nerve to swell as it comes through the skull, and it cuts off its own blood supply, and that's why the nerve dies, and that's why people get that facial palsy. But what his wife had was something completely different, and I'll explain that after the break. Don't know where to start on your skincare journey either? We all have that something we'd like to take care of. For me, it's the under-eye bags and puffiness when I don't get enough sleep and the dryness here. Thankfully, I discovered Genucel. I started with their serum for under-eye puffiness and then found their Genucel XV moisturizer, which dramatically changed my face's texture. After only a few uses. For Susan, she hates the annoying area under her nose during allergy season. She tried everything, but no matter what, her skin is dry and flaky and nothing seemed to help. Till she found Genucel's Silky Smooth XV moisturizer, soaked right in. She was hooked after one use and now loves all of their other products. Genucel uses a proprietary base formulated by a pharmacist and clinical levels of botanical extracts for the best skincare money can buy. Genucel products are cruelty-free, natural, and made in the USA. I cannot think of a better set of products to take care of my skin. Plus, they guarantee happiness with all of their products. See results you love guaranteed or your money back. Try Genucel's most popular package today and use code DREW for 10% off your entire order. That's GENUCEL.com and code DREW for 10% off. Excited to have Genucel with us. They are a product that we can stand behind. Susan was using it over the weekend, I noticed.
Always.
Mm-hmm. And
I like the vitamin C serum.
That's for
underneath the skin creams. Yeah, it's great.
Interesting.
It's really good. And then the retinol. I'm using all of it.
Good.
The under eye creams are all excellent as
well.
And
and Caleb, have we solved the problem of international access to the website? Is that still, you're still working on that?
I'm still checking on it. It's available in most countries, but there's some people I believe were having a little bit of trouble, but they had ways of working around it. So I'm going to try and get the official way soon.
Okay. I'm going to go on to talk about Justin Bieber's wife syndrome in just a second. Somebody asked me, do I have any insight into COVID psychosis? I don't know what you mean by insight. We know that psychiatric illness is very common. Various kinds of cognitive distortions are very common after COVID. I will tell you that after the 1918 flu, the influenza so-called epidemic of 1918, Dr. Menninger, who was the most famous psychiatrist of that era, felt that somewhere around 80% of all the psychiatric illness he was seeing at the Menninger Clinic was post-influenza. And he listed all the different psychiatric syndromes he had seen, and it was essentially everything. And a lot of it was thought disorder. A lot of it was, and was mostly temporary. I was looking at you got to remember that even though they've documented brain shrinkage and all kinds of things neurologically related to COVID, the brain is a resilient organ. It can recur. It can heal. And so just because we've had these insults, it's much like a head injury, much like getting hit in the head. Yes, it put you at risk for all kinds of things, but it doesn't mean that it necessarily is going to put you at risk for things down the line or continue. So back to
yeah, let's talk about Bell's palsy.
Justin's wife. Okay.
I had Bell's palsy.
Susan had Bell's palsy.
It looked just like that too.
Well, all Bell's palsy looks the same. You can't close your eye. You get a facial droop. Your mouth doesn't move. That kind of thing.
And now I have one small eye.
They all look the same.
I hate it.
You had it. Susan had it because she had such expansion of her blood volume by having 3 babies inside. Her blood volume expanded to the point that the blood couldn't get through the opening, the so-called skull os, the opening that the facial nerve comes
sort of like
through.
that guy's cholesterol. to his penis.
Kind of like that. Yours essentially choked itself out because the volume was so great it couldn't get through, and it started restricting the blood supply out here to the facial nerve. And you really didn't have a complete palsy, did you? You had like a partial.
I did.
Yeah.
No, I didn't.
In any event,
I was so freaked out.
Yeah.
But I was okay with it because I was going to have 3 babies. So.
And they put you on corticosteroids because the possibility was that it was a viral thing anyway.
Yeah.
So they.
I mean, I'm sympathetic to that. Bell's palsy sucks.
Then Susan went into shock after she delivered 3 circulatory systems because they forgot to put her on stress doses of steroids.
But here's the other thing.
Her adrenal glands.
How much of this is press-related bullshit, though? That's what Jeremy was going to call about, because he was like, how come they both had it? Like something else is going on, and we're not getting the real story.
All right. So the fact that Justin Bieber, a lot was made of a common problem, I would take issue with. Bell's palsy, because Justin is on there going, I have a rare problem. No, you don't. You have an unusual and uncommon feature of Bell's palsy, maybe.
Can you get
Bell's
it from
palsy,
drug abuse?
Very common. It's very common.
With drug abuse?
Not typically.
No.
You can get it from the vaccine. It's well documented issue with the vaccine is Bell's palsy. He can't close his right eye, and how the right side of his mouth isn't moving when he tries to smile.
That sucks. That's what I look like.
It comes back, and again, if it's Ramsay Hunt, the methylprednisolone is more effective than prednisone. Hopefully, they gave him that. But in any event, so there you go. He's going to have, in all likelihood, a complete recovery. Not a big deal. His wife's thing was a much bigger deal. She had what's called a paradoxical embolus. When she said she had this sudden, I think it was weakness on the right side of her body, I immediately said she has a patent foramen ovale. That's what she has. That's what does that in a young person. Normally, we all have small clots that frequently come out of our legs and make it to our lungs and are sort of screened out by the small vessels in the lungs and dissolve there. But if you have a hole in their atria, you know what? Why don't you if you can put a picture of a patent foramen ovale up there, Caleb, you'll get people. So the heart comes into the right side. The blood comes into the right side where there's a blood clot coming out of the leg that would normally get screened out by the lungs. Because of the patent foramen ovale, it gets across to the left side and gets to the brain. Okay? Yeah. And when it gets to the brain, it causes symptoms. We have a good friend, Susan, that just went through the same thing a couple of months ago. And it's very, very scary because it can be transient but massive. And sometimes the strokes can be massive and permanent. So the symptomatology can be, they can't speak and they can't move at the right side of their body, left side of their body, whatever. And so
that could be from the vaccine too?
Well, that's the question. So as you know, everyone knows.
Or cocaine.
No, stop it. Stop with the drugs. I really that's
or too many babies in your uterus at the same time.
You're not listening to me. Oh, there it is. So there's the patent foramen ovale showing the right to left shunting. The stuff comes out of goes into the blue atrium and gets across to the red atrium, then goes straight down to the ventricle and up to the head. While normally there shouldn't be that connection between the 2 upper chambers of the heart, and it should go into the lower blue chamber and then to the lungs and then kind of dissolve. Now, if you have a big clot, which we also know COVID causes, you get something called a pulmonary embolus, and it's very, very serious. So COVID does cause clotting. We also know that some of the vaccines cause clotting too, right? The Janssen, the AstraZeneca vaccine, I had clotting from that. We know that it caused sort of what's called a thrombotic thrombocytopenia syndrome, almost like the way it's like a heparin-induced thrombocytopenia, coagulation activation, and that's clotting. And so that vaccine, it makes sense to me, might put people at increased risk for paradoxical embolus. I don't see where the mRNA booster is likely to do that. So while it could be causing the Bell's palsy on Justin Bieber's syndrome, I don't really see where it would likely cause the paradoxical stroke. I'm guessing more likely that his wife was on a long plane ride or something like that, where these small clots are more likely to form.
Maybe, yeah.
Interesting, right? Okay, that's my.
What
Justin
a coincidence.
Bieber. Yes, it is an interesting. Well, not a coincidence
because they both had something around the same time.
But they are unrelated. They're not in any way. They're like
just a coincidence.
It's like saying he had pneumonia and she had arthritis.
Right,
It's just unrelated. They're not related. Though one involved a clot, which we sometimes associate with COVID, and one involved a viral reactivation, which we associate with the vaccine sometimes. So okay,
maybe, yeah.
All right.
We're not saying it is or it isn't because we can't
I'm
prove
saying
it.
it's interesting.
But it could happen.
Maybe.
That's why I'm leery about getting a booster.
Kenneth, what's going on there? Whoop, we're not connected to Kenneth yet. There we are. Kenneth, what's up? Kenneth?
Hello. Can you hear me now?
I hear you now.
Hi, Dr. Joe. Thanks for taking my call.
You bet.
I just had a stent put in. I had a AAA.
Mm-hmm.
It was 5.7 meters. No.
Centimeters. So let me tell people what this is. So he called what's called a AAA. It's an abdominal aortic aneurysm, which is, so you can get aneurysms in the aorta typically in two places. Well, you get it in the thorax, and it could be ascending, transverse, or descending, or all of the above. Or you get in the abdomen, which is kind of a mess, and it's a big operation to get that fixed. Were you a smoker?
Yeah. I am. I don't drink. I don't do drugs.
Okay.
I smoke about a half a pack a day of ultralights, which I know every doctor in the world's gonna say it doesn't matter and all that other stuff. But
Okay. All right.
My doctor tried to put me on the patch. My ultralight cigarettes are 0.08 milligrams of nicotine.
Good.
The patch is 23 milligrams of nicotine. So one patch was like me smoking 400 of my cigarettes.
Well,
I felt like I was going to die.
Well, that's interesting. Yeah, one of the big problems with those patches is most people don't use enough. But you can get the lozenges and the gum and other things to try to replace the nicotine. I'd urge you to do it. The nicotine is not the problem.
I know.
The tobacco is the problem, not the nicotine. But go ahead.
Okay. Well, I mean, what I was getting at was earlier, one of the callers was talking about the 81 milligram aspirin. I heard some negative news about that recently.
Yeah,
you really shouldn't take it if
right. So the what you heard is, should an average person, say over the age of 50, be on a low dose of aspirin as just a health maintenance prophylaxis of some type? And for a long time we thought that should be so, but it's not so. It needs to be applied for specific therapeutic intent. For instance, I have Lynch syndrome, and it turns out that people with Lynch syndrome on aspirin produce less polyps. So guess what? I take aspirin every day. You have an abdominal aortic aneurysm with a large piece of plastic in your gut or in your abdomen. And you need to make sure clots don't form on that plastic, and your doctor will tell you how to do that. And aspirin may be part of that. Have they recommended that?
Yeah, that they did. They did recommend it, but I've been taking it for a while now.
Stay with it.
I was taking it
Stay with it.
I was taking high blood pressure medication, a statin, because of the aneurysm. They were keeping an eye on it every year and all that. And then finally it got to the point where they didn't want to take any more chances.
How was that operation? How'd you do with that? It's a big operation. How'd it go?
Believe it or not, the biggest problem I had was the coming out of anesthesia. And then that's when I started putting the patch on. So I was going for 0.1 milligrams of nicotine a day to 23.
Yeah.
It really did a number on me. And so, but the surgery, I had very little pain.
Amazing.
Obviously, you can't feel anything inside.
Right.
The two incisions, which I'm not sure why they did two, but the two incisions, they healed immediately. They glued them. I had it done at Mass General Hospital.
Great.
Good hospital.
Oh, yeah.
Great hospital.
Yeah.
And then, and the recovery was very quick. I was up and about the next day.
Count your blessings, my friend. The cigarettes can do more than abdominal aneurysms, right? They cause cerebral vascular disease, coronary disease. Yeah. Think about the lozenges. I think you're the kind of person that those lozenges might be just right for. And don't be afraid of the nicotine. Be afraid of the tobacco. So, oh my gosh, we're getting some interesting stuff going here. This is, thank you, Kenneth. This is Patty. Now, Patty, you're muted. There you are. Patty, what's up?
Hi. I'm calling from Austin, Texas. I'm a retired nurse, a palliative care nurse. And recently, my husband of 40 years passed away. He had heart surgery and aortic valve and mitral valve and bypass. And he had been diabetic 58 years. And they got in, it was a mess. So he had 11 days in the ICU, and it was very difficult to watch him. I knew he wasn't going to make it. And so I'm calling about grief because it is. I did palliative care. I stood by hundreds of families in the ER who lost loved ones, but I have never felt such physical pain, chest pain, not sleeping. I just got blood work back. My kidney function's off, and it's hit me like a brick. So I wanted you to talk a little bit about the stress of grief.
Well, the extraordinary things about primate. We believe that primates can die of grief, right?
Right.
There's various ways that both chimpanzees have been observed to die of grief, and our own biology to result in very significant medical pathology. I think people are sort of aware of the sort of broken heart syndrome, where your heart literally stops, doesn't work right, get failure.
Right.
It's a sudden death syndrome. But you're not talking about that. You're talking about the stress, and the pain sort of goes without saying, right? I believe, well, there's good evidence that we very focused on the nervous system up here, right? But we have a large body of nervous tissue here and here. I'm pointing at my gut, and actually in the pelvis as well. And these are almost peripheral brains. And when people say, I feel this in my heart or my heart aches, I believe wholeheartedly it is this neurological material actually sending messages. And those messages can be disabling, not just from the standpoint of not sleeping and not eating and not drinking, but it almost has a, what's the word I'm looking for? A neurasthenic effect. You know what neurasthenia is?
No.
It's wasting. It's just sort of wasting. And there used to be a syndrome in psychiatry called just neurasthenia, and they eliminated it. And I've been a fan of that term for a long time. It's really sort of fatigue and wasting, and it has it's a feature of our nervous system dysfunction, dysregulation, overly burdened, either by a virus or by a trauma or an event. And the Patty, I don't know how, you know all the grief therapeutics that are out there, right? I'm sure you're taking advantage of some of that.
Yes, I have.
And I don't want to sort of, this is heavy stuff, but my friends and patients that go through this always say the same thing when it comes to loss of a spouse, a particular long-term spouse that you really love.
Right.
Is that you never get over it. You just regulate it. You learn to live with it. And my instincts are that it's impossible without filling your heart with other people and maybe fulfilling activities, whatever that means for you.
Yeah.
And you've certainly heard that as a palliative care nurse. You've seen those groups and stuff.
I should listen to my own medicine. But I'm just really taken back by the physical aspect.
I know.
The pain is just so intense. And I have a history of autoimmune, not lupus, but one of those broad named undifferentiated, and so I anticipate that it's going to go nuts from the stress.
It could easily.
And that's why my kidney function's going down.
It could easily. But why should we be surprised by, look, the self is embedded in a social context, and no more so than in an interpersonal context with close, intimate connection. When that part dies, that is a part of you. It just is. And it's one of the, unfortunate realities of having a good relationship is that you really lose a part of yourself, and you've got to you have to force yourself out there to sort of rehabilitate yourself in the face of this. If you lost a leg or something, same idea. You got to get out there, because it can do you in. It can. I don't think it will. I think you're going to be, you'll get through it. I mean, you're knowledgeable.
I'm a fighter.
You're a fighter. You get it. But the pain is what the pain is, and I'm really sorry you're going through that. But you got to sort of think about the fact that again, you get philosophical a little bit with this, but you need somebody else to share this with you, which is
and
that you had what you had. You know, don't try to keep that in your heart. What was yours, and not focus on what you've lost. You know.
Right. It's an interesting too. You know, being in the ICU, and having worked in palliative care there, and then being on the other side of the stethoscope was a very interesting experiment.
I'm sure it wasn't fun. I'm sure it was not fun.
Extremely stressful.
Yeah.
And the morning that that Craig was not doing well, and we knew that we were going to withdraw the pressors and let him go, his heart surgeon who'd worked so hard, he looked at me and he had tears in his eyes, but he said, "We're going to stay the course and I'll see you on Monday." This is on a Friday. And he bolted. And so he abandoned me.
But you know, having been a palliative care nurse, you know the surgical mentality.
Yep, and they don't want to lose.
They just can't deal with death and dying. They don't want to deal with it. They want to get people back, and they turn the death and dying over to internists and palliative care people like you. And so they have no skill. Unfortunately, they're not good at it. I'm glad. It's probably better that he didn't stick around, because he was, you know, had his own shit he was dealing with, and he dealt with it his own way. I wish he could have at least been present with you for a minute, but
he just did not have the capacity.
No,
to
exactly.
do it. No.
He just didn't have it. And he probably sensed the pain that was coming your way too. So I'm so sorry, Patty, but I feel like you still have important work to do. So please take your own advice, okay?
Okay. Thank you, sir. Thank you for talking to me.
God bless you.
You see how, right?
Reminds me of my show.
Yeah. Yeah, it's something.
But, you know, sometimes when you get to talk to him through a psychic, it makes you feel better.
Well, that's true. People get some closure, but I don't think that's what Patty needs.
It might be too soon, too.
Yeah, it's a different
You got to wait a while.
Hold on a second. I'm trying to figure out. Okay, Leah, there you are. I'm trying to, I'm going to get up here. Leah, what's going on there? You caught my attention. Thank you for waving at me.
Hi.
Hey there.
Okay, so I wanted to ask you about two different things, but combined them.
Okay.
I have post-COVID syndrome.
Lovely.
I've had it.
So fun.
I had it since since May of 2021. And I keep waiting to get better. I mean, I've tried so many treatments.
What have you tried?
I've had infusion treatments of 17,000 micrograms of vitamin C plus all the other vitamins. I've had 6 of those. I've tried ivermectin. I've tried, I haven't done the monoclonal thing. But anyway,
hold on.
A bunch of different things.
Okay.
My doctor is really into multiple, like, let's find out what we can do. And
Yeah, that's good. So let me bring up a couple of interesting things I've seen people do. I could not recommend it. We don't have the data to suggest it yet, but it's just interesting things people are doing. And by the way, have you checked out covidlonghaulers.com?
I have a link to it. I have a podcast called Long Hauling with Lady Leah. It's nothing big. It's just for people to hear the symptoms and also to hear the brain fog. The brain fog I find the most frustrating. It's extremely frustrating.
I know. I had it myself. So again, go to covidlonghaulers.com. They have lots of interesting ideas there.
Do they put it on the website, or do you have to sign up and pay?
You can go to Facebook and look it up there.
That's good.
It's easy to find.
Yeah, Dr. Yo probably has a lot of information.
Yeah, go to covidlonghaulers.com. So I'm going to suggest 3 things. Talk to your doctor about, some people are trying Paxlovid. They're actually trying did you do that?
That was my second question.
Yeah.
Was about that drug.
If I had bad long hauler, I would think about that. Fluvoxamine really helped me. I know some other people for whom it didn't help, but fluvoxamine really helped me with the brain fog.
Right?
I was about 2 months out.
Do they suggest it after?
The earlier the better with fluvoxamine.
Yeah,
but
same
we
with
don't
the
know.
monoclonal antibodies.
Yeah, the monoclonal antibody is not likely to work. The fluvoxamine is another idea. I have seen people take. This is going to sound very weird, but I was thinking about it this morning when I woke up, and I've just seen no literature on it, but I've heard of people doing this, is NAD infusions. I guess it's occurring to me now because I'm going to have an infusion doctor come in here in a couple of days, I think Thursday, to talk about infusion therapies. And NAD is a very, very common one. Again, no literature that I know of to back that up, but just an interesting idea out of desperation. And finally, the other thing is for your fog, I found learning languages very helpful in clearing the fog. Like, I know it sounds bizarre, but we were going to Greece, and I thought, I'll try to learn in Greek, and it really helped.
Maybe taking a vacation to Greece will help too.
But before that, it started helping. So I really would recommend. And I had the sense. I don't know if you have this sense. My sense was that some sort of physical, musical something would help me. So I also thought about going back to piano and sort of working at that, because I had this feeling that those sorts of language, music, movement phenomenon could help clear it. And it sure did for me. Now, it might have been a coincidence, but who knows? So there you go.
Well, so I wanted to ask you, my second question is sort of about that. Like Thursday, I tested for the third time positive with COVID. Okay.
Oh my God.
This last time I had it was in December of 2020.
That's weird.
And, so I got this, and I have a fever, and I have all the symptoms. So my doctor put me on the medication you just mentioned, which I already forgot the name of it.
Paxlovid. Good.
Yeah.
Okay. So what happened was I started to take it, and first I got that nasty taste in my mouth.
Yeah.
And then
very common.
The day after I did like 1 pack, and then I took my second day dose, the morning dose, and I got a real bad hive, like all over the back of my neck.
Oh, no.
So I looked it up on the FDA website, and it says to discontinue it if you get a rash.
Yeah.
And I wanted, my doctor is so bummed out because she thought it would help me a lot.
I thought so too.
Well, maybe she should get the monoclonal antibodies since she's got COVID.
Yeah, now monoclonal, and there's only really one that works. There was
you're supposed to do it within the first 5 days or something.
Evusheld is the one that I think works still. Evusheld.
I live in San Diego County, and they have the free bank here that I can go to, but today would be my last day.
Well, then do it. Then do it. Why not? For the acute COVID, for sure.
Drew loved it.
And I also,
helped me a lot.
The young lady who was just speaking about losing her spouse, since I got post-COVID syndrome, my mother-in-law moved in with us. She had dementia, and she passed in December. My son died in February, and my uncle died in March. And I have to say that the hospice people have helped me so much dealing with my grief.
I'm sure.
They're trained in grief therapy, and they're free generally, especially if her husband was on any type of hospice.
You may have missed it. She was a hospice nurse.
Oh, I didn't know what that palliative care meant.
It's hospice.
I've never heard that term, so they never called it that when the nurses came. But she should have good reason right there at work.
You heard her say it. She needs to take her own advice. She does. She needs to do what she knows how to do. You're absolutely correct.
I'm so sorry for your loss.
It's awful.
Thank you very much.
Awful.
What is going on? I have tears streaming down my face, but it's just.
Honey. You're having a rough time.
Now, let me say one more thing. I want you to write this down too. There is another antiviral. If you can't get the monoclonal antibody, it's called molnupiravir. That actually is pretty good.
I don't think I can spell that.
MOLNU, molnupiravir, molnupiravir. It's actually a pretty good medicine. And when the research was coming out, I was looking for
fluvoxamine. You took it while you had COVID, didn't you?
Yeah, you could take that also, but it really does. This stuff is very, very good. So in terms of reducing the duration and all that stuff. So, and you might get the side benefit of maybe wiping out some of whatever's causing the long COVID. But check out covidlonghaulers.com, Leah. Thank you so much for this call. I got to wrap things up. I actually have to go see a doctor myself, take care of my own health care right now. Have I talked about?
Thank you so much, all you listeners on Twitter.
Yeah,
Spaces.
The Twitter Spaces is a great
new blood.
It's a great leap forward. By the way, I'm watching you guys also on Rumble. I see what your comments are. Rocco Coro says, "Do language, study languages, do ayahuasca, just in the spirit world." I mean, let's be careful.
They're a little more open with their thoughts on Rumble,
yes, they are.
Which I appreciate.
I don't trust
there
any
are a lot of viewers
anymore, not after this. It's nice to see people awake in the chat, though. Squeezebag, I don't blame you for not trusting physicians. I don't blame you.
And if you're over on Rumble and you want to get on the show and ask a question, just go over to Twitter Spaces. We'll start opening it up over there, and we'll try to take more calls this week.
Paxlovid is good. You're saying it's not good. It is good. It is changing the whole landscape.
But I will tell everybody, if we do have a guest, which we are going to, we might have to add an extra little time on the end, Drew, so you can take calls, because we don't get to questions until the end of the show.
What do you mean?
If we have a guest,
oh yes, of
we
course.
usually interview for about an hour. Maybe we can go an extra 15, 20 minutes and take some calls.
Yes, absolutely. We will do that. I will do more calls.
It's called Ask Dr. Drew.
Look, I love doing calls. I love doing it. And these calls have been great. You guys, the Twitter, each platform has its own sort of character of callers.
Or we can start 30 minutes early and then take the guest. I don't know, whatever.
So Squeezebag doesn't trust doctors. I don't blame her. But we have not performed well in this pandemic, I would say. But
I think we've ruined
realize
doctors.
that most physicians, here's the enemy. Let me tell you, two things are the enemy. The enemy is centralization of authority. Medicine should not be a centralized phenomenon. It should be highly trained individuals, decentralized to use their judgment. The only person that only concerns him or herself with the well-being of that one person, the patient. Decentralization. Centralization is the enemy. I heard Peter Thiel give a lecture the other day, and he was saying that was the problem with what's happened with computing as well. And I agree. Centralization is the enemy. Bureaucratization is the enemy, and nowhere more so than in medicine. And yeah, we have not performed well as physicians because of that. But we can get it back. We can. I hate to see you not trusting you. Find a doctor you can trust and work with him or her. You've already heard today in these calls some very good physicians doing their job and improvising and trying to help the patient. That's what the job is, to try to use your judgment. Novavax is out, guys. Novavax has been approved, should be out soon. We'll see what the recommendations are. I think personally, if you're allowed to use Novavax as a booster, I personally would probably take it as a booster, but we'll see. We'll see what they say. For people over 75 who've had no adverse reactions to the mRNA vaccine, probably keep going with those boosters. Although I have seen some pretty nasty reactions for the third booster in people who had no previous reaction to it, or the second booster, I guess it is. All right, everybody, thank you for being here. We appreciate it. Good discussion, good calls.
I think we reached out to a lot more people today.
I think it's good. Mm-hmm. And Caleb, thank you for setting this up. Anything you want to say, Caleb, about how we're going to proceed here with the...
Good idea.
Oh no, this is very exciting. There were hundreds of people trying to call in on the show. We were on the front page of Rumble, so there were hundreds of viewers there. YouTube was taken off, so it's a big show all around. So thanks everybody for coming on.
And Roko Koro agrees with me that centralization is the enemy. Yeah, it is the enemy. I'm telling you, it is. If you look at some core, root cause is centralized authority in people who have gone a little wacky with that, and they've made people that oppose their authority a problem. That's a problem. Just watch my interview with Jay Bhattacharya. That to me was sort of eye-opening in a way that I cannot describe. And I've been retweeting a lot of his stuff. I've been retweeting a lot of his stuff lately. In any event, we'll be back tomorrow at 3:00. We will take calls. I'm seeing we're having, I'm not sure what it's going to be tomorrow, but we'll probably have a guest. Yeah. Do you know who it is? Oh, she's going to look for it so we can promote it to you all. Really do appreciate the Twitter.
It's TBA.
Yeah, that's what I saw too.
She didn't put it up.
So we'll tweet it out.
But Wednesday we have Gen Minard.
Who is that now?
Gianna Caldwell and Dr. Drew. Oh wait, that's something else.
No, that's a meeting I have to go to.
Okay. I don't know. She sent everything. She just didn't.
But thank you for announcing my meeting. That's well done.
I hope that wasn't secret.
I don't know. I've been too busy.
Yeah, it was a secret meeting, but I guess maybe the Twitterverse will show up.
Okay, Lauren D'Angostino and her boyfriend Angostino on Wednesday.
Regarding?
And how do you say that?
I don't know.
Angostino?
No, it's not on my.
David Nazarian Thursday.
Oh, David Nazarian, I mentioned that is the IV therapy doctor. He's a very good guy.
And then Lauren Angostino and her boyfriend.
I don't know what that is all about. So
I don't know.
Okay.
She comes up with good ones, and then let's see, Tuesday.
Guys, I must
TBA.
go.
We have a TBA tomorrow.
All
Maybe
right.
It'll just be Ask Me.
And it could be just calls again. We have plenty of calls, and they were all excellent. So
we're so organized over here.
Thank you, Kayla, for setting this up.
I'm
Thank you,
remodeling.
Susan, for doing an extra show today.
It sucks.
And we will see you all tomorrow at 3:00.
Ta-ta.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.
So are you saying that, like, she should do more therapy and maybe do a little less
porn, more therapy,
Yeah.
less porn. I'm saying, but much like the alcoholic has to stop drinking, she's going to have to go cold jerky for a little while. And
Cold jerky.
There you go.
True.
And not, it's an old Loveline term.